What if sleep apnea could be treated with a pill instead of a CPAP mask? A new sleep apnea drug just showed promising trial results, and it may change treatment in the future. This experimental sleep apnea medication cut breathing interruption by nearly half in some patients. Hello everyone, I'm Dr. PK. Today I want to talk about a very exciting development in sleep medicine, a possible pill for obstructive sleep apnea. So let me be very clear from the very beginning. It is not yet a replacement for CPAP and it is not yet a standard treatment, but the results are very promising enough to that many people are paying attention to this. So I wanted to bring this to my follower. What is this obstructive sleep apnea? Obstructive sleep apnea, OSA, happens when upper airway repeatedly collapses during sleep. That leads to pauses in breathing, drops in oxygen, poor sleep quality, snoring, daytime fatigue. Over time can increase the risk of high blood pressure, heart disease, stroke, diabetes, poor concentration. This is why sleep apnea treatment is important, because many people struggle with CPAP. CPAP works very well when used properly, but some people find the mask uncomfortable. They have claustrophobia, noisy, difficult to tolerate long term. This is why researchers have been searching for other options, including oral medication. This new medicine called sulthiame, 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 or sulthiame, Sulthiame. It's an older medicine which has been used for other conditions. Researchers are now studying whether it can help stabilize breathing during sleep in people with obstructive sleep apnea. In a phase 2 randomized clinical trials, researchers studied 298 adults with untreated moderate to severe obstructive sleep apnea. And participants were assigned to placebo or one of the three sulthiame dose for 15 weeks. Results were encouraging. The people taking sulthiame had a dose-dependent reduction in sleep apnea severity. The higher dose groups showed a strongest benefit. Some patients showed up to 47% reduction in breathing interruption, and sleep oxygen levels and some symptoms measures also improved compared to placebo. This is a big reason the story is making headline. And sulthiame is thought to work by improving the body's breathing control system and helping maintain upper airway muscle activity. In simple terms, it may help reduce the tendency of the airway to collapse during sleep. Does this mean CPAP is going away? No, not at all. This is the most important point. CPAP is still established standard therapy for many patients for moderate to severe sleep apnea. This pill is still investigational. A study has been promising, and larger studies will be conducted to confirm long-term benefit, and which patients respond best, and what are the long-term benefit, whether improvement is enough to reduce long-term complication. Who might benefit most in the future? If future studies continue to look good, medication likely like this may help patients who cannot tolerate CPAP, patients who want another option beside mask-based therapy, patient whose sleep apnea has a strong breathing control component. But right now we are not yet at this point. So the bigger picture, study is important because it shows sleep apnea treatment may be entering a new era. For years, people mostly thought of CPAP, oral appliances, weight loss, positional therapy, and surgery. Now, we may be moving toward a future where targeted medication become part of a treatment toolbox, right? So here's the bottom line. New clinical trial suggests sulthiame may reduce obstructive sleep apnea, improve oxygen levels, improves sleep-related symptoms in some patients. It's still experimental. CPAP still remains key treatment right now, but this is a very hopeful development, but not yet a cure, not yet a replacement, and yet something people should start asking um, um, for outside proper clinical guidance. If you have sleep apnea, the most important thing is still this: get diagnosed, get treated, do not ignore it. By the way, I just have a 70-year-old patient I saw today, female. For 8 years, she had not used her CPAP machine. Her cognitive decline has been moderate, so she's scared now. All the workup for her dementia, other causes have been ruled out. So I'm getting her, she got sleep apnea test 2 days ago. I don't have a result, but she was told by the technician that she had severe degree of sleep apnea. Untreated sleep apnea will cause cognitive decline and damage to your heart and your metabolism definitely. So don't ignore it, please. Thank you for watching. If you found this video helpful, share it with someone who snores, wakes up tired, and struggles with CPAP. There's a good news on horizon. Thank you.